To everyone watching this who has been told to just learn to live with it, I made this video for you because what you're about to hear is different from every appointment, every leaflet, or every piece of advice you received up to this point. Not because I'm about to promise you a miracle, but because the truth about what is possible for tinnitus is dramatically better than what most people have been told. And most people have been told almost nothing. I spent 3 years running the only tinnitus support group in central London. I know what people in your situation have been through because I've heard it week after week in the same room. You know, you sort of went to the GP, maybe an ENT consultant, possibly even an audiologist. You had the hearing test, it may have come back normal or not, and someone kindly, mean and well, told you just learn to live with it. I want you to know something important about that. Those clinicians were not lying to you. They were being honest about the limits of what they had been trained to offer. That is a training gap, not a clinical verdict on what is possible for you, because the information they did not have is exactly what this video is about to give you. So here's something most people with tinnitus are never told. Tinnitus is not an ear problem. Yes, it often begins with something happening in the ear, so noise exposure, age-related hearing loss, an ear infection, but itself lives in the brain, in the way the brain's filtering system has learned to process and to amplify a signal that is decided to treat as a threat. And the brain can learn differently. That is not comfort I'm offering you, hopiums. That is actual neuroscience. What research has established across decades of clinical trials is that tinnitus responds to a three-dimensional approach: the emotional layer, the auditory layer, and the attentional layer. Most treatments address one of these. Some address two. We address all three. We address all three at the same time, in the same program, built around your specific pattern. That is what we call the NeuroQuiet Tinnitus program, and this approach is not available anywhere else. Let me give you the evidence, because in this space there is a lot of noise and you deserve the actual data. 85%, that is the proportion of patients in the largest clinical trial who showed meaningful improvement in tinnitus severity after 12 weeks of treatment, not while using something to cover up the sound. Actual measurable lasting change in the brain. And 91% of those patients were still better a year after finishing treatment, after stopping, because the brain had rewired and it stayed rewired. The device at the core of this program, linear bimodal neuromodulation, is CE marked, clinically validated, and was rated the highest available tinnitus treatment by Tinnitus UK in the independent 2025 review. In 2023, the FDA also granted it de novo approval, the first time any device of this kind had been approved in history. And that sits on top of an already substantial evidence base. A Cochrane review, the highest standard of evidence in medicine, pulled data from 28 separate clinical trials and 2,733 patients, and confirmed that structured tinnitus approaches like this produce meaningful, lasting improvements in sleep, quality of life, and emotional distress. But I want to tell you about a patient I worked with, because data does not always show you what is actually possible. She had come through cancer treatment, unfortunately a double mastectomy. This arrived straight afterwards, and by the time she booked her appointment, she was convinced she had nothing left to give another program. We did not ask her for any heroic thing at all. We built her program around what she actually had, just 2-minute attention drills she could do in bed, small sound environment adjustments that required no extra energy. The turning point was not the day her tinnitus changed, it was the day her belief about herself changed, from I cannot do this to even now I can still make small steps in the right direction to move my brain in the right direction. She habituated. Tinnitus is no longer the dominant feature of her daily life. Now, our patients rate us 4.9 out of 5 stars on Google across over 140 independent reviews. 2 of them really stay with me. One says, straight away, I lost any anxiety about the tinnitus. While it is still occasionally quite loud, I notice it less often and does not bother me when I do notice it. Awaji Mijana did not just help me feel better, he restored my confidence in health professionals. That second one means a great deal to me, because that confidence, the belief that someone in the clinical world can actually help, is where everything else begins. But what makes verified hearing different is not actually one person, it's not me. It is the standard we hold every specialist to. I train under Mr. Tony Kay, who is one of the most experienced tinnitus clinicians in the country. He's now retired, but he was the past president of Tinnitus UK. He showed me practically what happens when all three systems are addressed together. Patients who had been written off by conventional care began to habituate. One of them had bilateral tinnitus, for instance, for 10 years. Another had tried every available treatment without success. Both habituated. That experience became the foundation of everything I do here. So we have two clinics in central London. One's on Wigmore Street and the other on Harley Street. Both are built around one conviction that people with tinnitus have a thorough evidence-based clinical pathway. Not a 10-minute appointment or giving you a leaflet and sending a referral. The specialists here are specially trained in tinnitus. They attend research conferences to keep up to date with the research, and they stay very close to the lived reality of tinnitus patients in ways that only one appointment can't provide, which means whichever specialist you see here, you receive the same rigorous assessment and treatment, the same three-dimensional approach and the same genuine commitment to helping you find your way back to life. So let me tell you what the first step looks like, because I want you to understand what you're actually getting before you decide. The NeuroQuiet Assessment. It is a single appointment, and in it we do something that has probably never been done for you before. We look at your tinnitus completely. We start with advanced audiological testing, so your pure tone audiometry, which is your standard hearing test, and then autoacoustic emissions, which is more specialized, looking at disrupted signal processing in the cochlear tympanometry to see exactly what's happening in your hearing system. This is also called medical clearance. Before we proceed with any treatment, we rule out any underlying causes that need attention. If further investigation is needed, we work with a dedicated ENT specialist in London, and we send you there. From there, we build a complete tinnitus profile using Tinnitus Functional Index, a validated clinical tool. We measure how your tinnitus is affecting you across 8 specific dimensions of your life, not just how loud it is, how it affects your sleep, your concentration, your relationships, your sense of who you are. And then we sit with you, we explore your unique experience, your emotional response to tinnitus, your patterns, your triggers, the version of this that belongs specifically to you. And at the end of the appointment, you leave with something most people with tinnitus have never received: a clear roadmap, not generic advice, a personalized plan that tells you exactly what your three-dimensional treatment looks like, with answers you may never have had and a path forward that is specific to you. You'll find the full details and pricing below this video, and there are 2 routes in. If you haven't had a recent audible assessment in the past 6 months, the NeuroQuiet Assessment is the right starting point. It includes the full clinical picture alongside the tinnitus consultation. If you have had a comprehensive hearing test within the last 6 months, you can just go straight ahead, book the tinnitus consultation, and we will begin from where you already are. Before you decide anything, I want to ask you something. If the NeuroQuiet program works for you, and the evidence says it works for most people who go through it properly, what would your life actually look like? What would you do differently that you're not doing today? Where would you go that you've stopped going? What side of you would come back to life? That is what we are here for. Not to manage your tinnitus, to help you get back to the life it has been quietly taking you from. I want to be clear about something. I'm not a motivational speaker, I'm a scientist. So when I say that it is possible for you, I'm not offering you hope. I'm telling you what the data shows and what I have watched happen in this clinic with real people who were in the exact same place you are now. People who had the same ring-in, the same sleepless nights, the same appointments that led nowhere, who habituated, who got their lives back every week at this clinic. That continues to happen, and I want that to be you. Below this video, you would find 2 options: NeuroQuiet Assessment or tinnitus consultation. And if you already have had medical clearance, choose the one that fits you, and we'll take it from there. I'm looking forward to seeing you and welcoming you to Verified Hearing and Tinnitus Clinic. Thank you.